One of the things that is very common is this winter itch. What do you recommend, Dr. Strawn?
So winter causes dry skin, and dry skin is the gateway to itch, which is the gateway to eczema, and it can make your psoriasis flare. So a lot of skin conditions get worse when your skin gets dry. So the key is what we call gentle skincare. So if you think of
Okay.
your skin as like holding a lot of water and it has an oil layer on top of it, a lipid layer on top of it, the lipid layer keeps all the water in your skin from evaporating. So a lot of the things we do, wash our hands, take a shower, scrub our skin, use a lot of hot water, use strong soaps, strips the oil out of our skin.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Hi, everyone. Welcome, welcome, welcome. Welcome to another episode of the Care Room with Dr. Cindy. I know I say this every single episode, but I have another amazing, amazing, amazing guest with me. It's Dr. Dina Strachan. She's joining us from New York. She is a board certified dermatologist. She owns her own practice in New York, Aglow Dermatology, and she is just gracing us with her presence today. And I am just so honored. But before we get into things, I'm going to let her introduce herself and tell us all about what she does.
Well, thank you for that great introduction. And it's great to be here, Dr. Cindy. And we have another guest, my cat Lennox, who's going
And
to
he
join the
is welcome.
podcast. Yes. So if you hear him, he's just weighing in. And yes, I'm a board certified dermatologist in New York City. And my practice focuses on, dermatology is skin, hair, and nails, but my focuses on hair loss, skin of color. We do medical and cosmetic dermatology, and we take care of patients of all skin types.
Yes, and that's what we need today. We need it, Dr. Strawn. So, can you tell us how you got into dermatology?
So I came into dermatology through my interest in AIDS. I was in medical school back in the 90s, and I wanted to do infectious disease. And the AIDS epidemic was in full throttle then, and a lot of the patients would get skin problems. Pre highly aggressive antiretroviral therapy, like 96% of patients with HIV would get either a more severe presentation of a very common skin problem or unusual skin problems, but the dermatology clinic was full. So we were calling the dermatologists all the time. And I was very
Yeah.
impressed that they seemed to know a lot of things that other people didn't know about. And so I felt that was a really unique way I could help that patient population.
Wow, I love it. Wow. So through you thought you were going to do infectious disease and then, in doing that, you saw with the AIDS patients that a lot of them had skin problems. Do you do a lot of that today? Do you work with that population with AIDS?
Well, thankfully, because of the medication that happened in the middle of my residency, we went from being slammed, right, to
Right.
having a lot of those conditions fade away. So a lot of the patients in that population are just in the general dermatology population. I don't know that there are a lot of HIV dermatology clinics anymore because it's not
Right.
needed, which is a good thing.
Which is a good thing. We'll take it. We'll take it. It's a good thing. So can you tell us how your practice has evolved today
So
from that?
I was in academia for 4 years. And after
Okay.
I finished my residency, I worked in Los Angeles at a county hospital that had two dermatologists that included me for a catchment area of like 1.6 million people or something like that. And that was really busy. I learned a lot there, just general medical dermatology. Then I
Right.
moved back to New York and I worked at a teaching hospital. Then I decided to go into private practice. Not honestly, I didn't go saying yes. I I just did not like academia, And I did not think of myself as a private practice person or a business person. I thought of
Right.
myself more as an artist. So, but I found that going into private practice, my own specifically, seemed like it was like the only way I was going to have the work life that I wanted.
Right.
And
Right.
then I found that I was a great business person. Being in business is artistic.
Yes. Yes. Preach it, Dr. Strawn.
That's right.
I have some doctors listening too, so I'm
Yes.
sure they're hearing this. Oh
Yes.
my goodness. I totally agree. It does give you the freedom to kind of do it your own way and have that work-life balance. Totally agree. Totally agree. So Dr. Strawn, a lot of our listeners are busy moms. They have kids, busy women, professional, and they have lots of questions. As a primary care doc, I tend to get a lot of them, and sometimes I wish I could phone a friend, right? So that's what you're here for me today. I have those questions. So one of the questions I frequently get from moms relates to sunscreen. How much sunscreen should they use on their kids? And especially with those with skin of color, which sunscreens would you recommend?
So for everyone, we recommend SPF 30 or higher with UVA protection, and they use sunscreen every day,
Hmm.
regardless of your skin color. You can get away with doing less, obviously, if you're darker, because you have a little head start in terms of protection.
Right.
The types of sunscreen that people of color should use, they should use the same, except the issue becomes whether or not it's cosmetically elegant on their skin. Because some of the sunscreens are opaque, and so they leave a film, like a white cast on the skin that
Right.
doesn't look very nice.
Right.
So their formulations, there's so many different formulations now that you should be able to find something that is acceptable to you, that looks appropriate on your skin, and that to give you the protection that you need. But the protection that we recommend is pretty much the same for everyone. It's just the vehicle that they get it in is different. And then if
Sure.
you have certain problems, you might want a mineral sunscreen, like if you have melasma or something like that.
Okay, so there are different types. Okay, mineral. Okay, but SPF 15 and above.
Well, we recommend 30 because
30. Okay. Okay.
15 is effective and the difference between 15 and 30 isn't very much, but that's assuming that people put on enough. And
Okay.
so if they put on less than enough, that it's like a curve, and so it drops pretty fast if you go below 15. Whereas if you put on half of 30, you're still above. You're in the range of acceptable protection.
Got it. Okay. So guys, SPF 30 and above. Okay. How frequently should we see a dermatologist?
Well, that will depend on whether or not you have a history of skin cancer, you have a skin condition. Most people, if they are getting, and also is someone looking at your skin? Is your primary care doctor looking at your skin? And do they feel comfortable with what they're seeing? So, I
Right.
mean, you could just easily say go once a year and get a skin check. You should get it from someone. I
Right.
mean, if you have absolutely nothing on your skin, your primary care doctor could probably detect that. But you can have your dermatologist take a look as well. And then it's usually based on what we find.
Sure. My ladies who love to get their nails done. Another question we get is I've gotten asked, is it safe to use the UV light? Like when they put their fingers in, is that UV light on the skin safe?
I
Yeah.
mean, I can't say that it's safe because it can potentially increase the risk of cancer. And certainly, if you are doing it frequently, that would be a concern. Some people have gloves where they put their fingers through and they have the nails done. And so they just have that out without exposing the skin. And with the polish on, the nails should be protected. But some people are moving more towards recommending powder,
Okay.
the powder manicures. But I
Okay.
can't
Okay.
but I can't say there's no risk with using UVC.
Sure. Sure. And are you concerned if, say, you're using the UV light, but you're not you're doing it weekly because you want your nails to look a certain way, but you're not doing it for half an hour or as long as they typically do it for your.
I mean, it's the amount of exposure, any exposure, it's like sunbathing. it accumulates over time, so it can increase your risk. I don't have particular numbers, but I just
Sure.
know that it increases your risk. So
So,
is it so low? And it would be interesting to see some data to
sure.
see.
Agreed. Which brings me to my next question. Tanning, that a lot of women love to do. What's the recommendation there?
That you don't do it.
None at all. Not even just a little bit like the UV, it's dose dependent.
Well, when
Um,
you lay when you tanning booths, I mean, that's like eight that's like sunbathing 8 times. So those are considered carcinogens.
sure.
They're very dangerous. I mean, you don't have to be a vampire. We all want to live and be out, but it accumulates over time. So you don't want to get a burn. The more times you get the sun exposure, the more it increases your risk. Now, if you're darker, you can get away with that a little bit more, not 100%, but a little bit more. But if you're very fair, you're just increasing your risk of skin cancer.
Thank you for that. Thank you. So, guys, you heard that. No tanning booths. Dr. Strawn said it, and Dr. Cindy
Sorry,
agrees.
I'm the party pooper, sorry.
I know, I know. I don't want when it's one of the patients coming in and say, Dr. Cindy, I heard that you said no tanning booths. Yes, we said no tanning booths. So, Dr. Strawn, can you walk us through what we should be concerned about on our skin if we see we have a mole, it's been there for a while, we were born with it? What are the concerning things that we should look out for that would make me say, oh, my doctor needs to check this out?
Yeah. So I would say new lesions or changing lesions, right? Because moles are benign. We're not really worried about moles. We're worried about it being a cancer, which is something else. So the sign that something might be changing into something malignant or be something malignant that is now starting to look abnormal. We have for melanoma the ABCDEs, and A is for asymmetry. So if you cut it in half, one half looks significantly different than the other half. B would be irregular, jagged, or blurry borders. C would be ABC. Gosh, it's late. Sorry.
That's okay.
Change
Color,
in
right?
color, change
Yeah,
in color, change. D, diameter greater than half a centimeter. But again, I've diagnosed melanomas that were very small. And the only thing about it, I was not so worried, but it was a little weird. Like there was some erythema around the mole, and we couldn't explain why there was redness around the mole. It was a melanoma, and it
yeah.
was tiny. It was like a pinpoint, but it was
Cool.
melanoma. I caught it very early, and E is for evolution.
Yeah.
The
So
C is
thank you.
for various colors, changes in color.
Changes color. Yeah,
And
yeah.
then lots of colors. Like melanomas can be all black, they can be one color. But if you see something that's tan and white and black and brown, that's more suspicious as well. Not a lot of benign pigmented things look like that.
Sure, sure. And what about those spots that you start getting on your skin, the dark spots as you age, especially in people with darker skin?
Are you talking about on the face?
On the face, some women, I've seen it under the breasts,
Are so you
some
mean that
getting,
raised one? So I think you're talking about seborrheic keratoses, or on the face we call it dermatosis papulosa nigra, and seborrheic keratoses are usually bigger on the body, and that's just very common. That's genetic. They're kind of non-viral warts. They're not infectious. They're except well genetically infectious they are.
yes, I don't think the patients would like to know they're not using the term warts. Anyone gets like, what? No.
Yeah. And they're just something that grow on some people. So they can be removed. Sometimes they're harmless unless they get inflamed. Some people get uh inflammation or a lot of itching around them.
Sure. Thank you for that. So, seborrheic keratoses, and then on the face, can you repeat what it's called?
Yes. Dermatosis papulosa nigra, or DPNs for short.
DPNs, DPNs. Love it, love it, love it. I'm gonna start using all these, fancy new terms. So, what would you recommend? We're going into winter. One of the things that is very common is this winter itch. What do you recommend, Dr. Strawn, for that?
So winter causes dry skin, and dry skin is the gateway to itch, which is the gateway to eczema, and it can make your psoriasis flare. So a lot of skin conditions get worse when your skin gets dry. So the key is what we call gentle skincare. which is things that you do to keep your skin from getting dried out. So if you think of
Sure.
your skin as like holding a lot of water and it has an oil layer on top of it, a lipid layer on top of it, the lipid layer keeps all the water in your skin from evaporating. So a lot of the things we do, like washing, when we wash our hands, take a shower, scrub our skin, use a lot of hot water, use strong soaps, strips the oil out of our skin. And so the water will evaporate and you get dry. And then in the winter, dry heat, dry cold, taking long hot showers to feel better after being cold. All of those things make your skin dry. So what you do to address that is be mindful of not taking too long a hot shower or bath, maybe not have it be too hot. Use a soap that is moisturizing and not you don't have to soap your whole body every day unless you're actually dirty. You can just do face, neck, armpits, groin, buttocks, that's all. And then moisturize after you get out of the bath or shower. Those are the key things.
Sure. Sure. Is there a specific moisturizer that you guys recommend that's better than others? I know like there are some that are different textures, like
Well, there's
CeraVe or
yeah, I mean there
yeah.
are many different brands. So I'd say you want to get one that's not fragranced. In the winter you might want a heavier one like a cream that's a little heavier
Okay.
than a lotion.
Okay.
One particular product that I like because I find it works for pretty much everyone, and men are a little tougher because they have body hair and they don't like sticky things as much, is Eucerin Advanced Repair. And you put
Okay.
it on once and it has pretty good substantivity, meaning it stays on your skin and it doesn't get all over your clothes and hands. And, at the end of the day, your skin is still moisturized.
Yeah. You said that was Mucerin?
Eucerin
Oh,
Advanced
Eucerin.
Repair,
Yes, yes.
but it's Advanced Repair. That that line of products, Advanced
Yes.
Repair.
Sure, sure. Good to know. Thank you for that. And I just want to go through just a few myth busting questions, right?
Sure.
A lot of us, we tend to have kids with eczema, and a lot of them haven't heard of bleach baths. Can you talk about that? Like, we actually use bleach on the skin. Can you shed some light on that?
Yeah, so people with eczema are more likely to be colonized by Staphylococcus aureus. And so that can make the eczema worse and increase the risk of getting an infection. So you don't put a lot, you put some bleach in the water, and that reduces the bacterial load.
Yeah.
And some of the hypochlorous acid in bleach can have an anti inflammatory effect.
Oh, that's the science behind it too. Second one was the face masks. Are those really helpful?
What kind of face mask?
You tell us. Yeah.
I mean, are you talking about red light? Are you talking about mud masks? Or
So there is the red light mask that's popular now, right? I
yes.
think yeah, a lot of people use the red light mask before they go to sleep. And then the one at the spa where you have those on your face.
So a mask is just a vehicle, so it just depends on what it's delivering.
Sure.
So if it's delivering red light and you want it for anti-aging, there is data behind that, but that's helpful.
Okay.
It just depends on what you're using it for. So
Okay.
just think of it as a vehicle.
Okay. Okay. Got it. Got it. Because like we have our nighttime routines that we really don't put much thought into. We're just doing it because we feel like it makes things better. And it's what we've done since our teenage years, and we do it once, twice. So we all have this nighttime routine, and the mask is a part of it. Um,
So it depends on what's in the mask.
Mask, yeah. Okay, got it. Got it. Got it. Anything else you would like to bust open in terms of myths?
Wow. Well, I'd say as a hair loss doctor, one of the things I think is really important is that people understand that there are different types of hair loss. And so it's become such a big industry that everyone has their solution and they can treat hair loss, but you really should get a diagnosis of what your hair loss is before you start a treatment. Like
Okay.
you can go online and people will, "Oh, I can give you this. I can give you minoxidil. I can give you that, but is that what you need? Do you have do you have thyroid problem? Are they addressing your thyroid problem?" I mean,
Right.
your hair shedding, hair loss can be a sign of an internal medical problem. So by just thinking of it as generic hair loss and going and just getting a prescription from someone who didn't really evaluate you, you miss the opportunity to identify a problem that you have that you need to address.
Got it. Got it. How else do we treat hair loss? I know like there are the steroid injections, you mentioned minoxidil. Can you shed some more light on that and what the diagnostic process is?
Well, I mean, your treatment is based on your diagnosis. So we don't just give everybody minoxidil or just give everybody injections. We first figure out why they had it. So we take a history, we do a physical exam, and then we go down different pathways, based on whether or not we think it's a scarring type of hair loss or not a scarring and what kind of what pattern it is. We may do a biopsy. We may get blood work. You don't necessarily do that for everyone. It's not necessary. So you have to sort of understand that you're just dealing with different things. It's like saying that we're going to have sandwiches for lunch, but you don't know what's in the sandwich.
Is a scalp biopsy painful?
Well, we numb you. So the only thing you should feel is the injection, and then you
Okay.
should be numb. And then you have stitches for like a week or two. It's usually one or two stitches.
Okay. Okay. Okay, Dr. Strawn, this was so helpful today. Thank you, thank you, thank you. For our listeners who loved what they heard, they're in New York maybe, or they're in the tri-state area. How can they find you?
Well, they can follow my practice, Aglow Dermatology, on Instagram at Aglow Derm NYC. And they can follow me on Instagram at Dr. Dina MD. That's DRDINA MD. And I'm also on
Yes,
LinkedIn at Dr. Dina MD.
MD. Okay. Guys, she's awesome. Definitely check her out. If you're in the New York area, Aglow Dermatology, that's the place you want to be for any of your derm needs. I say this every week. I have awesome, awesome docs on, but she is truly one of them. But next week, we are going to have another awesome doc on. But until then, take care.
Bye.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.